Hey everyone, it's me, Miss Ruiz, and today we're going to discuss Chapter 6, the Musculoskeletal System. Let's get started. Learning outcomes for this chapter include 6.1, identify the parts of the musculoskeletal system and discuss the function of each part. 6.2, define combining forms used in building words that relate to the musculoskeletal system. 6.3, identify common diagnostic tests, laboratory tests, and clinical procedures used in testing and treating disorders of the musculoskeletal system. 6.4, we will define the major pathological conditions of the musculoskeletal system. 6.5, define surgical terms related to the musculoskeletal system. 6.6, discuss common pharmacological agents used in treating disorders of the musculoskeletal system. And finally, 6.7, identify common abbreviations associated with the musculoskeletal system. Let's begin. Learning outcome 6.1, structures and functions of the musculoskeletal system. So as you can see, this system is our framework. It includes bones, joints, and muscles. And they work together to hold the body together. They allow for movement, and they protect and support all of the internal organs. The skeletal system is marked from top to bottom as follows. We have the skull, sternum, rib cage, cartilage, vertebrae, sacrum, upper limb bones, knee joints, and lower limb bones. The muscular system is marked from top to bottom as temporalis, pectoralis major muscle, aponeurosis, tendons, and sartorius muscle. Combining terms for this system include ankylo, means bent or crooked. Arthro means joint. Brachii or brachio means arm. Burso means bursa. Calcaneo is your heel bone, so that's the heel. Calci or calcio is calcium. Then we have carpo, which is the wrist. Cephalo, which is the head. Then we have cervico, meaning neck. Remember, cervico in this case, because we're in the musculoskeletal system, is referring to the neck. If we're in the female reproductive, then you can see where there'd be a cervico that means cervix, but that is not in this case. Chondro means cartilage. Condyle or condylo means knob or knuckle. Costo means rib. I had a student remember this by, like, in biblical terms, that Eve cost Adam a rib. So Eve costo Adam a rib. I don't know if you want to make that connection. Then we have cranio, which means skull. Dactylo, which means fingers and toes. Fascio, which means fascia, that's the bands that cover the muscle fibers. Femoro means femur. Then we have fibro. Fibro means fiber. Humero, it's for humerus. Ilio means ilium. Another thing to mention here, there are 2 iliums in your body. So it's important to know there's an ilium in your digestive tract, but that one has an E versus 2 I's. So just know the one with an E is included with the one you eat. The one with the I is in your bones. Then we have ischio for ischium. Kypho means hump or bent. Lamino means lamina. Leiomyo, that is smooth muscle. Then we have lumbo, which means lumbar. Maxillo is your upper jaw, like your maxilla. Then we have metacarpo, which means metacarpals. Meta means beyond, so we're beyond those wrist bones, which we had for carpo. Then myo means muscle. And myel, spinal cord or bone marrow. There you go. Remember, I wanted you to remember these, the difference between myo, myelo, and last chapter's myco. So make sure you are clear on the differences. Then we have osteo. Osteo means bone. You're going to see that one a lot. Patello means knee. Pedi or pedo means foot. This word part can also mean child, but you're going to look for contextual clues in the documentation to know whether or not you're referring to a foot or a child. Then we have pelvi, which means pelvis. Phalango, which means finger or toe bone. Pod means foot, podo. Pubo means pubes. Then we have rachio, which means spine. Radio, forearm bone. Rhabdo, that means rod-shaped. Then we have rhabdomyo, which is striated muscle. Scapulo, which is scapula, that's your shoulder blade. Then we have scolio, which means curved. You might hear of scoliosis. There's actually 3 of these terms that you're going to put together. So we have already seen kypho. So there's kyphosis, scoliosis, and lordosis. And then we have spondilo. Spondilo means vertebra. And sterno, which means sternum. Then we have synovo, which means synovial membrane, produce synovial fluid, which acts like a lubricant for our joints. Tarso means tarsus. Remember, that's our foot. We live in the tar heel state, so it's a great way to remember that tarso is going to be dealing with your foot. Teno, tendo, those both mean tendon. Then we have tendino, which also means tendon. Thoraco, thoraco means chest. Tibio means tibia, ulno means ulna. And vertebro means vertebra. One thing I do want to mention with tibia and fibia, those are 2 different things. It's a tibia and the fibula. There's no such thing as a fibia, which I had just mentioned because some of you have probably heard that before. So it's tibia and fibula. All right, types of bones and bone marrow. Bone provides shape, support, and framework for the body. There are a total of 206 bones that are in the skeletal system, which is classified according to their shape. There are 5 different shapes, and you need to know these. There's a long bone, short bone, irregular, flat, and sesamoid. Now, sesamoid is kind of like your kneecap. It's held in place by cartilage. A long bone example would be like your femur. A short bone, that could be like the ones in your finger. Irregular, that would be like your vertebra. Flat bone, that would be like your scapula or your pelvis. There's those wide flat areas. Let's look at the anatomy of a long bone. So the anatomy of a long bone shows 11 individual labels from top as follows. We have the articular cartilage, the epiphyseal plate, spongy bone, space containing red bone marrow, nutrient artery, endosteum, compact bone, medullary cavity, yellow marrow, periosteum, and articular cartilage at the base. The combined labels for the 4 major sections from the top are proximal epiphysis, diaphysis, metaphysis, and the distal epiphysis. As you can see here, we have examples of our different types of bone. So A would be our long bone, B would be a short bone, C is a flat bone, D is an irregular bone, and E is a sesamoid. Now let's talk about bones of the head. We have the cranial bones, which form the skull. Cranial bones protect the brain and structures inside the skull. Next, we're going to look at them in a little more of a dynamic view. So as you can see, it might look like it's one piece, but it's actually composed of multiple different bones. So here you can see we'll start on the left side. We have the parietal bone, which is that blue piece. The occipital bone, that purple piece at the back, that's where we also have a muscle back there called the occipitalis. If you put your fingers back there and raise it and lower your eyebrows, you'll probably feel it. Then we have our temporal bone. I know many of you probably heard of your temples. And then we'll go back on the right side. So starting at the top, we have the frontal bone, which is the orange piece in the very front. That's also where our frontal lobe is, the area that's responsible for making all our decisions. Then we have the sphenoid bone. That is my personal favorite, and this image is not doing it justice because it actually spans across the skull, and it kind of looks like a bat shape. Then we have the ethmoid bone, the lacrimal bone, which is that little blue part. That's also where our lacrimal gland is, and that means tears, so it helps produce those the saline tears. Then we have nasal bone, which helps us with our nose. In zygomatic, those are your cheekbones. And then you can see your maxilla. Maxilla is your upper jawbone. And your mandible is your lower jawbone. Fun fact, the mandible is the only bone in the skull that moves. Next, let's look at sinuses. There are 4 sets. So here you can see we have the frontal sinus, the ethmoidal sinuses, and the sphenoidal sinuses, as well as the maxillary sinus. A lot of times if you get a sinus infection, you'll really feel it in that frontal sinus and the maxillary sinus, especially if you're chewing sometimes. You might have felt that if you were really compacted up there. Now we're going to talk about the spinal column. It extends from the base of the skull to the pelvis, and it supports and stabilizes the body. Let's look at the spinal column. So as you can see, the spine is made up of vertebrae, and at the end we have our sacrum, which is actually composed of 5 bones that fuse together over time, and then our coccyx, which is at the end. Let's break down our 5 divisions of the spine. So at the top we have our cervical vertebrae. Remember, cervico means neck, and we have 7 of these. I like to think of breakfast, lunch, and dinner when you're trying to remember the number of each vertebrae type. And then next, below that, we have thoracic vertebrae. Remember, this is also where our ribs are connected at. Thoraco means chest. You normally have lunch at noon, so you have 12 of those. Then for dinner, we got lumbar. Lumbar vertebrae is our back. Usually it's the lower back area. And then it's also related to the sacrum, which is again composed of 5 bones, and that's your lower back. And finally finishing it off is the coccyx vertebra, which we also know as the tailbone. Now let's look at the bones of the chest and pelvis. Weight transferring sections that keep the body balanced. So we have the upper group, which includes the clavicle, which is, a lot of people call it your collarbone, scapula, which is your shoulder blade, and it transfers the weight of the upper body evenly to the spine. Then we have the lower groups, the pelvic girdle. I know you've heard of our pelvis, right? That transfers the weight of the body from one leg to the other leg. Now let's look at the rib cage, which is the chest, and this is where we have our thoracic vertebrae, and this is what connects all of our ribs. Now you'll see we have a division in our true ribs. True ribs connect from the back to the front. Then you have false ribs. Notice they don't quite connect to the sternum, but they connect to the 7th rib. So they are still connected, but not the way the true rib goes straight from the vertebrae to the sternum. And then you'll notice 11 and 12 are floating ribs. They actually don't attach to the front in any way. Now let's look at the male and female pelvis. You'll notice that the pelvis is larger and broader in females, and this is to accommodate childbirth. You can see both of them have the symphysis, which is the cartilage area right here in the middle. It allows for some flexibility. And back here you will see that we have the sternum and coccyx right here. Now we're going to talk about bones of the extremities. So extremity bones of the arms, hands, and legs provide movement. Muscles attached to these bones aid in body movement. Let's look at some of the bones in the arm and the hand. So here we have our clavicle. The clavicle, remember, is our collarbone. Then we have the scapula, which is our shoulder blade. Humerus. Then we have the radius and the ulna. The radius is always on the thumb side. If you take your thumb and hold it out and draw a circle, you notice you can make a radius. That is the side that the radius bone is on. Your ulna is on the pinky side. Another way to remember this, you might have heard about it. If not, here it is. I've had some students say you are humerus, so you remember all the different bones of the arm. U is ulna, R is radius, and humerus is the humerus. Then you can also see we have the carpus, which is the wrist. Metacarpals, those are the bones after the carpus, or the carpals. And then you have your phalanges, which are the finger bones. Now we're going to look at bones of the legs and feet. So you see we have the sacroiliac at the top. That's that upper portion right where it connects from the sacrum to the iliac crest. And then we have the coxa, which is also known as the hip. And then the pubic symphysis, we saw that previously in the male and female pelvis area. It's a bit of cartilage between the two. And then you can see we have that long bone, which is the femur. Then we have that sesamoid bone, which is the patella or the kneecap. Then we have the tibia, which is the big shin bone, and the fibula. The fibula is a supporting bone to the tibia. Then you can see we have our ankle, or also called the tarsals, and then the metatarsals. The metatarsals are what form the top of your foot, if that makes sense. And then you have your metatarsophalangeals and your interphalangeals, which are also your toes, and phalanges, again, which are toes. Those are your pedal phalanges. All right, let's look at joints described by their movement. So types of joints. We have a ball and socket joint, which you will find in your shoulder and your hip. We have a hinge joint, that's your elbow, right? Or your knee. Then we have a pivot, the saddle, and the condyloid. All right, let's talk muscles. So they contract and extend to allow movement. Muscles contract and extend along the attached bone. There are 3 types of muscles for different functions. So for example, we have the deltoid muscles, which extend the arm, the bicep, which flexes the forearm, so it does the opposite of what the deltoid does. And then we have the mascatory muscles, which open and close the jaw for chewing. These 3 are to represent the different types of movement that these muscles can do. Now we're going to talk about the 3 different types of muscle. So here we have skeletal muscle, which is striated muscle. These muscles are usually voluntary, which means your body has to tell them what to do. Then we have one that's kind of a hybrid. So we're going to come back to this in a second. We're going to talk about smooth muscle. So smooth muscle is usually part of our internal organs, our visceral organs. It has smooth appearance. It's not striated. It doesn't have those bands in appearance. Now, usually smooth muscle is involuntary. So just like we don't have to tell our food to travel through our digestive system through peristalsis, our internal muscles just kind of do that. Those are involuntary. Now we're going to go back to the cardiac muscle. This one's interesting because it's kind of a hybrid. It is striated in appearance like the voluntary muscles. However, it does perform involuntarily. We don't have to tell our heart to beat. So that's why it's kind of its own type of muscle. Next, we're going to discuss a very important topic in the musculoskeletal system, and that is the origin and insertion of the biceps and tricep muscles, particularly the origin and insertion and what they mean. So the first diagram, labeled A, it shows movement of the forearm against the resistance of 10 kilograms. Biceps and triceps are 2 major muscles found in the upper arm that play a significant role in its movement. While lifting 10 kilograms of resistance, biceps brachii, or biceps, muscles contract, which create a force that brings the radius upside for lifting. During this activity, the tricep muscle, located opposite the bicep, relaxes. The elbow joint acts as a fulcrum, and the second diagram, labeled B, shows the movement of the forearm against the resistance of 10 kilograms moving on a pulley. While pulling weight, or its resistance, the triceps brachii, or the tricep muscle, contracts, which creates a force that supports the ulna to work in favor of the movement. During this activity, the bicep muscle relaxes. The elbow joint acts as the fulcrum. This is a great example of 2 different muscles working in tandem to do opposing jobs. Now let's talk about body movement. You'll see the term flexion a lot. That's the bending of a limb. Extension is straightening of a limb. Rotation is the circular movement of a part. Abduction is movement away from the body. Adduction, think of adding, subtracting, is movement towards the body. Then, if you'll remember a few videos ago, we talked about supine and prone, and we were talking about how we would eventually get to supination and pronation, which are movement terms. So as you can see here, supination is a turning up, pronation is a turning down. Then we have eversion and inversion. Eversion is moving the sole of the foot outward, inversion is moving the sole of the foot inward. Then we have the other two opposing, dorsiflexion and plantar flexion. Dorsiflexion is a bending up. So imagine you're standing on your foot, you bend and point your toes up to the sky. That would be dorsiflexion. Now imagine a ballerina standing flat foot and then she goes up on her point on the toe. That would be plantar flexion. That's bending down. Learning outcome 6.2, word building in the musculoskeletal system. So here we have ankylosis, arthrogram, craniotomy, brachiocephalic, bursitis, cervicodynia, chondroplasty, fibroma, humeroscapular, iliofemoral, and ischiodynia. Then we have maxillofacial, metacarpectomy, myelocyst, osteoarthritis, patelectomy, sternodynia, synovitis, and vertebroarterial. Learning outcome 6.3, diagnostic, procedural, and laboratory terms. These findings assist in the diagnosis of medical conditions. Often used in combination, these tests lead to a final diagnosis and assist in the treatment planning. We use these tools such as radiographs, finger goniometer, arthrography, electromyography, bone scan, and CPK. Learning outcome 6.4, pathological terms. Pathological conditions can occur throughout the musculoskeletal system, may be present at birth or occur throughout the lifespan. We also have spina bifida here and rickets as an example. Spina bifida, there are two types. So we have spina bifida cystica and spina bifida occulta. The enlarged view of the anomaly spina bifida cystica shows 5 labeled parts clockwise as back muscles, spinal cord, dura mater, cyst filled with cerebral spinal fluid, and rudiment of vertebral arch. The enlargement view of the anomaly spina bifida occulta shows 5 labeled parts clockwise as vertebra, incomplete vertebral arch, tuft of hair, skin, and spinal cord. Symptoms, abnormalities, and conditions. Let's look at some different types of fractures. So we have Colles, comminuted, green stick, oblique, an open compound, spiral, a transverse, simple closed, and impacted. Let's take a look and see what those look like. So here you can see we have a Colles, which is usually always at the wrist. Comminuted, as you can see, it's kind of splintered off into each other. Green stick means the bone is fractured on one side, but not necessarily all the way across. Have you ever tried to take a green stick, from a tree, and break it in half, and you'll notice part of it splits apart, but some of it stays together? Same concept. Then we have oblique. As you can see, it's a diagonal. Then we have an open compound, which means that it poked through the skin. Then we have a spiral, transverse, trans we know means across, simple closed, which means it did not break the skin. Then we have impacted. Impacted means one end of a bone got pushed into another, and so that created that impacted fracture. Joint disorders occur from everyday use of a joint or related to an injury. First, we have osteoporosis, which is dealing with your bone density. Then we have arthritis, which is inflammation of a joint. Joint disorders, osteoporosis. The height measuring scale for both women is marled from 0 through 64 in increments of 8. The height of the young lady is measured above 64 inches, and the height of the elderly woman is measured below 64 inches. Here's an example of the bone disorder arthritis. You can see a healthy knee On the left and on the right, you have a joint with arthritis. Bones and spinal cord. The bones of the spinal cord can also experience disease and disorders. Types of spinal curvatures include scoliosis, which is a side-to-side curvature, or it's a lateral curve. Then you have kyphosis, which is a front-to-back curvature, and that curve is at the top portion near the thoracic region of the vertebrae. And then one that is not mentioned here, but you should equally know about, is lordosis. Lordosis is also known as swayback, and that is an exaggerated front to back curvature of the lower part of the spine. Usually it's around the lumbar area. All right, learning outcome 6.5, medical terms. Orthopedic surgery may involve biopsies, repair, grafting, replacement, excision, or reconstruction of parts of the musculoskeletal system. These could include amputation, prosthetic devices, bone grafting, orthosis, orthotics, casting or splinting, or traction. Learning outcome 6.6, pharmacological terms. Most medications treat symptoms, not causes. Relieve or relax the area of pain by either numbing the area or by reducing the inflammation, such as a muscle relaxant, a non-steroidal anti-inflammatory drug, we shorten that to NSAID, narcotic, analgesic, or an anti-inflammatory such as a corticosteroid. Learning outcome 6.7, abbreviations. So in medical terms, AKA is not also known as, it is above knee amputee. AROM is active range of motion. C1 is the first cervical vertebrae. CPK is creatine phosphokinase. Then we have CTS, which is carpal tunnel syndrome. We have DO, which is a doctor of osteopathy. EMG, which is electromyogram. FX, there's another one of those X like we had for biopsy, but FX means fracture. NSAID, we just kind of talked about that. That's a non-steroidal anti-inflammatory drug. And then we have PROM, which is a passive range of motion. Not sure why it's twice up here. Guess they really wanted you to know this one. And then we have TMJ, which is temporomandibular joint. All right, let's review this chapter. So 6.1, the musculoskeletal system forms the framework that holds the body together, enables it to move, and protects and supports all internal organs. 6.2, the word building requires knowledge of combining forms and meaning. 6.3, diagnostic, procedural, and laboratory findings assist the healthcare provider in diagnosing medical conditions. Often used in combination, these tests lead to a final diagnosis and assist in the treatment planning. 6.4, pathological conditions can occur throughout the musculoskeletal system. These conditions may be present at birth or occur throughout the lifespan. 6.5, orthopedic surgery may involve repair, grafting, replacement, excision, or reconstruction of parts of the musculoskeletal system. Surgeons also make incisions to take biopsies. 6.6. Most medications used to treat disorders of the musculoskeletal system treat symptoms, not the cause. Often, treatment includes medications to relieve or relax the painful area by either numbing the area or reducing the inflammation. And finally, 6.7. We learned abbreviations are frequently used and describe location, disease, or care provided. All right, everyone, that's all I have for you today. Thank you so much for joining me. Please reach out with any questions. Until next time, have a good one.